Hi, I'm Dr. Barbara Cordell, and today I'm going to be talking about the ABCs of ABS. If you found this video, you've probably heard of auto-brewery syndrome. It's the syndrome where people make alcohol in their guts. So they actually have bacteria or yeast that are fermenting carbohydrates into alcohol. We believe that while it is rare, it is very underdiagnosed. So we're trying to get the word out and educate people about auto-brewery syndrome. The ABCs stand for alcohol, blood alcohol concentration, and contributors. So let's start with A, alcohol. If you're not drinking anything and you feel intoxicated, perhaps you have auto-brewery syndrome. Alcohol is the hallmark. I've heard people say, well, I have small intestinal bacterial overgrowth, so I must have auto-brewery syndrome. But that's not the case. Only if your body is making alcohol do you have auto-brewery syndrome. It's where a fungus, a yeast actually, or bacteria ferment into alcohol. So that leads us to B. How do you know if you have alcohol in your system? Well, you want to test your BAC. Most of us have heard of that term, BAC. It stands for blood alcohol concentration. And you can find out that level by having your blood drawn, but most of us don't want to do that. We would rather have a handheld device, which is called a breathalyzer. And these are available online. You can get them, and it will test your breath alcohol concentration. So you blow into the machine, not having had any alcohol to drink, and waiting 30 minutes after eating or drinking anything. And if you register alcohol, you probably have auto-brewery syndrome. Now, we've all heard of BAC and the legal limit being 0.08. So that kind of gives you a guideline of what would be a high reading if you did have alcohol in your system without drinking. And that leads us to the contributors, or the C. There are many things we know of that can contribute to auto-brewery syndrome, and each person is unique. So there are things in the literature that we talk about, like those comorbidities such as diabetes, obesity, short bowel syndrome, irritable bowel syndrome, certainly SIFO and SIBO, those things I mentioned before, the small intestinal bacterial or fungal overgrowth. Those are all contributors. We found some other contributors such as overuse of antibiotics, which overuse is hard to measure because we all have antibiotics. If we're meat eaters, we get antibiotics in a lot of our foods. But the use of antibiotics is one contributor, as is a high carbohydrate diet. Sometimes stress is a contributor. And all of these things need to be attended to if you think you have auto-brewery syndrome or if you've already been diagnosed. So A for alcohol, B for breathalyzer, and C for contributors are all the things that you need to know about in order to get diagnosed or to treat auto-brewery syndrome. If you already know that you have auto-brewery syndrome, we have a website, autobrewery.org, that we hope you'll consult for resources and other things. If you're looking for a diagnosis, please find a doctor, a nurse practitioner, someone who can help you. And we do have a list on that website. Again, it's autobrewery.org. And we just thank you for listening and hope that you get well and stay well.